Rebecca. So as council president, welcome to Areawide. When was the last time we met in person? January 2020. So any old business that anyone might have, if you can remember. No, I mean, we've met in between on the Hollywood Square thing, but not quite in person. Any old business? Okay, great. Let's move on to county updates here real quick. Let's start with Portage County. Do you have any updates with Portage County? Oh, you're wonderful.
I think it's just you.
What are you going to play, Phil?
I'm not really sure what they're doing, the center in Savannah, but I do know that in Portage County, Kent, which is where I'm from, we just absolutely were stagnant. Completely with COVID, just everybody's still staying home, still weary of the crowds, and they just don't want to get too close and with anybody they don't know or care about. So we have a lot of work to do. Yeah. Thank you.
Well, Melissa, on behalf of the group, we're glad you're here from Portage County. We're absolutely glad. How about Stark County?
Dan's here. He's online.
Oh.
Yeah, hi, this is Dan, and I guess the one new development here is I got connected to the ongoing age-friendly Stark County. Can you hear me okay there? Okay.
Yes, now we can. We're good.
Age-friendly Stark County, there's a committee that's formed and has been working for a few months. I just connected with it, and Matt came down. We had a meeting at Panera, and looking forward to seeing some progress with that, and I'll keep this group updated on whatever it does.
Great, cool stuff. This age-friendly stuff is really kind of fun. And it's, you know, been a long time coming for those of us who've been around for a while. Great stuff. Anything else, Dan?
That pretty much, oh, you know, doing some additional outreach to the senior centers. You know, I was able to establish contact when I did that little survey, and was able to connect Courtney with some of them and kind of see if I could nudge them into participating with some of her programs. So it's nice to have those connections.
Awesome. Awesome. Great. Good stuff. Thanks,
Okay.
Dan.
Thanks.
Summit County. Which one?
You want to report?
Sure. So Jeannie and Courtney and I. Sorry. Thank you. Jeannie and testing. Okay. All right. Jeannie and Courtney and I. There we go. 5th time's the show. Met to discuss some of the different things that are.
You will be better.
We met to discuss some of the things going on in Summit County, including the drum roll of Age Friendly Summit and Akron is officially merged into one campaign, and we now have 5 work committees that are scheduling their first meeting that are going to go through the 44 and 47 action plan steps to start getting stuff done. And so we're really excited to meet and figure out what this next step looks like and what our priorities are going to be for the coming year, 2 years. And we really hope that will create this kind of surge of interest in older adult sports that we will then be able to spread into other counties as well, so that our goal is that all 4 of our counties become an age-friendly designated community in the next, I'll say, 5 years. So very cool momentum. Jeannie is on one of the subcommittees and will be kind of a tether as well as the direction home staff between the age-friendly effort and area-wide.
And I just wanted to make one comment on Lisa, the Summit Expo, Senior Expo, fabulous, kudos to you. It was marvelous. Wonderful turnout, wonderful.
So we can, like Dan, can they hear him?
Fabulous. Thanks.
Okay.
All right, and one last comment from Jeannie on a kudos for Senior Summit. If you missed the last one.
We're making sure these guys can hear that are online. So that's why she repeated what you just said. Dan, can you hear us okay? Were you able to
It's
hear Matt?
It's
Okay.
still kind of difficult. Maybe if whoever's speaking could actually go up to where you are, because I'm hearing you loud and clear, but everything else is pretty badly muffled.
So Matt was just saying how the age-friendly communities are becoming kind of spreading out a little bit, and that Summit County and the city of Akron have kind of joined forces. And they've got some work groups that are starting and kind of moving things forward, which is a positive thing, because I think you guys have met forever. So now it's kind of like putting the wheels on the bus, and the bus is actually starting to leave the station a little bit and do some work. And then Jeannie was just saying kudos about the senior summit that occurred in May. Was that May? Gosh, it seems like a long time ago. So that's kind of brings you up to date.
Thanks.
No, sure, absolutely, yeah. So Wayne County. Anybody on from Wayne?
Yes, can you hear
Is
me?
she on?
Perfect.
Can you hear me?
Yes.
Yes.
Okay, well, I'm a newbie on this. So for the first thing I did was go to the community center in Worcester, where I talked with the people there in charge. They gave me the 50-cent tour. I hadn't been there since about 1982 or 3. In the late 70s and early 80s, for 5 years, I did the nurse on duty program there every Friday afternoon. They don't have it anymore. I skipped town and they quit. But I got the 50-cent tour of the place. I was really, really happy to see what they've done to it. They've got such a big exercise room and they've got lots of programs. And while I was there, I signed up to take sign language. They're going to have a class in sign language. It begins on August 24th. It runs 8 weeks, so I'm going to do that. And I tried to sell them on bingo size. I don't know much about bingo size, but I tried to sell them on it. So they're going to look into it. Okay, the other thing they have there is the food program. So I was going to meet with that person. Well, she was really late. Her helpers were there, but she wasn't there. So I didn't stay to meet her because I knew that she'd be busy putting all those meals together. So I've got to go see her another time. The other person I would like to really meet soon is whoever's in charge of fixing things for people, like, putting a ramp on the porch or something like that. So anyhow, I'm getting acquainted with everything.
Awesome, you're making those important connections. That's great. Great stuff. Well, thank you all for all the hard work you're doing and what you're doing for the council. Am I turning this over to Brandy now for our strategic plan? It's weird to see 2023 and 26 here. That's so strange.
All right, you should be good to go. I'm going to leave the mouse over the slide forward button so you can just left click it. So they can see me.
All right, hopefully everyone can hear me. Can I move this a little bit?
Yeah.
There you go. All right, good afternoon, everyone, in person and virtual. So I'm going to talk to you guys a little bit about our 2023-20 to 26 strategic area plan. This is something that the Ohio Department of Aging requires every AAA to put together. And we'll kind of go through some of this a little bit. And then if there's any questions, please type them in the chat or unmute yourself. And we'll also ask about questions at the end as well. So ODA put together this time around 7 focus areas, which are community conditions, healthy living, access to care, social connectedness, population health, preserving independence. And then there are some additional priorities that ACL, or the Administration for Community Living, kind of focused on as some of their priorities. So we'll go through each of these. So the first focus area, I'm gonna move this little box. All right, sorry about that. First focus area is community conditions. And there are 6 objectives that I had the pleasure of working with Matt to kind of come up with some of these things. What we did was we looked at things that we currently were already working towards and how we could potentially expand them, make them bigger, take them into other counties. And then we also looked at things that we haven't done yet that we wanted to do. So we added some things that are new that we haven't started working on yet into the plan. So for focus area number 1, the first is partner with the prosecutor's office, the mayor's commission, and other community organizations to offer protection trainings, specifically on things like scam prevention and safety. We've been hearing from the community that individuals are not feeling super safe in their own living environments. So that's one thing we want to focus on. And then scam prevention, obviously we all know that there's lots of that going on, especially during COVID. That's one of the unfortunate things that really has kind of risen to the top, is just the different ways that the scam artists are trying to take advantage of all of us, but specifically our seniors. So number 2 is identify and obtain sustainable funding in order to provide needed services to individuals who do not qualify for Medicaid. Number 3, research and identify housing development options to assist individuals with obtaining affordable housing. Number 4, assist individuals in obtaining needed minor home modifications. And then 5 and 6 go together a little bit. We're going to participate in Metro's strategic planning process. They actually reached out to us and asked if we would assist with that. So we're really pleased to be able to help in their endeavor. And number 6 is identify and obtain sustainable funding in order to provide medical and non-medical transportation to those not eligible for Medicaid. For focus area number 2, which is healthy living, we have 4 objectives. The first is to increase access to healthy food through expanding the farmers market program. Number 2 is to expand the congregate meal site participation. We want to expand the number of providers that we have providing congregate meals, and also the amount of individuals that go to the congregate sites. Number 3, begin offering bingo size classes in the community. And number 4, the expansion of falls prevention. And we want to specifically reach out to our faith-based organizations to provide some trainings for their congregation. Focus area number 3 is access to care. We have 6 objectives under this topic. So the first one is to create a Medicare education campaign, and our hopes are to reach at least 50 beneficiaries. Number 2, we want to implement and expand our telehealth programming. And this is one of the ones that we just recently started a couple weeks ago. So we have already worked through the implementation phase, but now we're working to expand this and offer telehealth to more individuals in the community. Number 3 is research the feasibility of becoming a PACE site. And PACE stands for Program of All-Inclusive Care for the Elderly. There's a big push for PACE sites across the country right now. And so we're currently looking to see if that's something that we would be able to start. It's just a different way of care, kind of all-inclusive, where individuals who are in this program can go to a facility, receive medical care, receive adult daycare type services, home health services, things like that. There's therapies. There's a lot of different things that kind of go into this. But there's also quite a bit of startup costs for this type of activity. So we're kind of just at this point researching, is this something that we're able to do in our area? Number 4, provide computers, internet service, and one-on-one individualized trainings for up to 700 individuals. This is one of the things that during COVID, we started this program. We've currently have given out 550 computers. So we're now working on the next phase to get to that 700 mark. But so we provided laptops, tablets, and desktops to individuals in the community who were either over the age of 60 or younger with some kind of physical disability. We also provided internet services to those who didn't have Wi-Fi in their homes. And then we have recently hired a peer support technician who's able to go out to the homes and do some one-on-one trainings and make sure they know how to use the device. We found that a lot of people were excited to get them, but then didn't really know how to use them or were nervous about doing something to break them. So we've been out there doing some trainings to help them actually be able to use them. Number 5, utilize our workforce development work group to create and implement a home health aid certification training and create a virtual provider fair to assist in matching aids with provider agencies. You probably are all aware that there's a major kind of home health aid crisis going on right now. I know in the last 40 years that we've been in business that, you know, there's always been an issue finding enough home health aides, but COVID has really exacerbated that, that issue. And so we're trying to look at ways that we can impact that crisis and help our provider agencies to be able to locate staffing. And also we have, you know, individuals on our waiting list that we're really hoping to get the care that they need. Number 6, expand the use of short-term facility respite stays to provide caregiver respite. And respite and short-term respite in facilities is something that we've always kind of been able to do. We just haven't utilized it as much as we probably should or could. So we really want to focus on making sure that our caregivers realize that this is an option. Focus area number 4, social connectedness. So we have 4 objectives here. The first is expand our age-friendly initiatives to 1 additional county, which you heard a little bit about that earlier today, that, you know, we have age-friendly already implemented in Akron and also this county of Summit. But now we're focusing on Stark County with the goal of expanding then also to Wayne and Portage. Number 2, provide activity boxes to individuals in the community to help combat loneliness and isolation. One of the things that we did over COVID is provide wellness kits and cabin fever kits to individuals in the community who, you know, were at risk for loneliness and isolation. This time around, we decided to partner with an agency that puts together the boxes and they'll send them out for us. During COVID, we were the ones to purchase all the items, put all the stuff together and deliver them. But we're finding it works out a little bit better for us to partner with an entity that already does that. So we're going to be getting out at least 1,000 activity boxes to individuals in need. Number 3, we work with the Ohio Arts Council on their creative aging campaign. And this aligns with our current arts and culture initiatives. So, you know, Matt can talk a little bit more about aging as an art form, but that's a program that we created during COVID, which is a really cool project. It links seniors with technology and also with local artists. And the artists will get on a Zoom call with a class and they'll teach them how to do various types of art activities. And then number 4, we want to recruit, train, and leverage our volunteers for advocacy initiatives such as our faith-based and first responders trainings. Focus area number 5 is population health. We have 3 objectives here. The first is collaborate with public libraries and dementia friends to provide trainings to professionals and lay leaders in the community. Number 2, partner with the Geriatric Workforce Enhancement Program, or GWEP, to provide training and increased awareness surrounding reducing hypertension. And the next one is reducing depression. So these trainings are already in the works. They'll be provided to medical professionals, as well as students who are going into the medical field or field of geriatrics in our 4-county area. And then focus area number 6 is preserving independence. The first is begin offering bingo size classes to the community. Number 2 is empower older adults to utilize outdoor spaces and activities safely in the community through an age-friendly focus. And number 3, identify and obtain sustainable funding in order to provide medical and non-medical transportation to those who do not qualify for Medicaid. All right, and focus area 7, these are the priorities that the Administration for Community Living brought about. The first is they would like us to support and enhance multidisciplinary responses to elder abuse, neglect, and exploitation. And how we feel like we are meeting this objective is we are part of the Nursing Home Task Force Coalition that includes Jobs and Family Services, Probate Court, nursing facility staff, and our ombudsman team. And this council focuses on things like elder abuse, neglect, and exploitation. Number 2 is improve coordination between the Senior Community Service Employment Program, or we call it CSEP, and other Older Americans Act programs. And one thing that we did with CSEP during COVID was we provided 30, I believe, computers to that program. So they were able to provide computers to individuals who are on the CSEP program to help, and they taught them how to use the computers and helped them use them in order to link them with employment. Number 3 is screening for suicide risk. We have an ongoing partnership with Summit County Change Direction, as well as the ADM board, or Alcohol, Drug, Addiction, and Mental Health Services Board. And one of the things we're going to focus on is addressing the suicide risk. Number 4, incorporating innovative practices developed during the pandemic. And again, we just highlighted here that we are working on getting 700 computers out to the community. Number 5, and this is my last slide. Number 5 is ensuring meals can be adjusted for cultural considerations and preferences, and providing medically tailored meals to the maximum extent practicable. And during the pandemic, we were able to create a restaurant initiative program where we contracted with local family-owned ethnic restaurants in the 4-county area. And we provided a couple thousand vouchers to individuals in the community, and they could go to the restaurant of choice and either eat inside to help get them out of the house and socialize a little bit, or they could get takeout from those restaurants. Number 6, supporting cultural experiences, activities, and service, including the arts. So we have staff from our agency that serve on the Diversity, Equity, Inclusion, and Accessibility, or DEIA committee of Arts Now. And one of the things that we're able to do being part of that group is just to make sure that older adults are included in the art offerings. Number 7, supporting participant-directed and person-centered planning for older adults and their caregivers. Direction Home is a participant in a work group that addresses the shortage of participant directed providers. And then number 8, documenting best practices related to caregiver support. Again, we're part of a statewide initiative regarding caregiver support programming. Does anybody have any questions about any of that? No, that was a lot. Yeah.
You guys came up with a really nice plan.
Thank you.
Yeah, it's very impressive.
Thank you.
You guys are doing.
For those of you online, it was said that we came up with a pretty good plan. So thank you. I appreciate that.
I'm going to sound very stupid, but I need to know, who would be the people that are not Medicaid eligible?
Okay. The question is, who are the people who are not Medicaid eligible? So in the community, there are quite a few individuals who need care, but have maybe a little bit too much money, so they don't qualify for the Medicaid waiver programs. Or maybe they just need help with like 1 or 2 little things and don't quite meet the nursing home level of care. So unfortunately, they wouldn't qualify for waiver services, and all of the waiver services are paid for by Medicaid. So I don't have it with me, but we have this little graph that we like to show where there's this little sliver of individuals who are eligible for Medicaid. And then there's a little sliver on the top that is the individuals who are like LeBron James, we say, where they have millions of dollars, they could privately pay for anything that they need. And then this huge box in the middle, which is kind of the rest of the, individuals in the world where you might have a little bit more money than that make, you know, so you don't qualify for Medicaid, but yet you don't really have enough money to pay for all the services out of pocket that you need. We have a little program called Care Coordination that meets some of that need for some individuals. But the issue is there's really no funding out there for people who don't qualify for Medicaid. That's the big struggle. Unless you're lucky enough to be in a county where there's a senior service levy, that's how most counties will meet those needs. So we're trying to get creative and figure out how we can meet those needs, you know, without individuals qualifying for waiver. Does that help? Yeah.
I just had a question, and you may have covered it, but in some ethnic groups and grandparents raising grandchildren, and so I don't know if I missed it. Is there? Are you partnering with and doing something in that area?
Yeah, not that I'm aware of specifically with grandparents and grandchildren. Yeah, Matt or Connie, do you know of anything?
I think that we definitely work with different organizations in the community. Foster grandparents springs to mind, but other groups as well. We've worked with Children's Services before. They have a large kinship care program that they work with the adult folks that are in that situation. It's more prevalent, I think, than ever, and there are unique needs of that kind of family dynamic that it's not necessarily in our scope as much as it is kind of family-based nonprofits, but we have worked with those to make sure that if the older adult in the house needs services or supports, that we can provide that, and then make sure that we cross reference with Children's Services and other supports in the community that we know of, so that the household will be supported with the resources and programs that we have available.
Yeah, for those of you online, I apologize, I should have rephrased the question, but it was regarding grandparents serving grandchildren. And, you know, is there anything that Direction Home is specifically doing in that regard? And Matt Reed mentioned that, you know, we do a lot with our foster grandparent programs. We support them as much as possible. And then Jobs and Family Services has a newer kinship program that they're working on as well. Any other questions?
I'm not familiar with the GWEP program. How could I get more information?
I can send you information on that after this presentation for sure. It's a really great program with a lot of different community partners. We partner with the local, some local colleges like Akron University and Neomed. There's Probate Court, Direction Home is part of the team, Summa Health Systems, University Hospital. There's a lot of different players. But our biggest focus is on just, you know, training on geriatrics, just making sure that those in the medical field and others are, you know, aware of the issues that are affecting geriatrics and know the best ways to interact. We do a lot with dementia friends trainings and things like that. But yeah, I can definitely get you on the email list and get you more information on that.
Thank you.
You're welcome. Matt?
I wanted to just provide a comment that while some of these feel very county-based in the direction, those are more put for examples, and that, just like I mentioned at the top of the meeting, our ultimate goal is to use Areawide as a best practice group that can then take successes from other areas and help the folks in this room implement in their own neighborhoods with Direction Home's help. So while we do mention some different areas that are county specific, that doesn't include any other county from participating in any or all of these programs. A lot of times what we found is we partner with elected official offices, and some are more receptive to working with us than others. And so what is the barrier there is just the willingness to partner with Direction Home and the elected official's office depends on the elected official. And so, you know, we offer to everyone for things like Brandy mentioned the computer, we call it Connect Me DHAD, the computer program. That was a partnership through Summit County where they funded that program and then we administered it. And so we do reach out to different parts of our region in the Fort County area, and we look to you as well for help doing that because you are the kind of boots on the ground, as they say. So this we feel like is a nice broad plan that we can work with all 4 counties in. We anticipate, like I said, best practicing and through the next 4 years to make sure that all counties are moving forward in the right direction.
You're fine. No, thank you, Matt. I actually meant to mention that and I forgot, but so for those of you listening online, if you couldn't hear Matt, he wanted to just make sure that we all were aware that some of these things on the plan might specifically say Summit County, and that's just a starting point. That's where we're starting, and the goal is to expand into all of these initiatives into all 4 counties, and that we do what we can to partner with county officials and others to find funding to do more things in other counties. So any other questions or comments? All right, I think I turn it back to you, Lori.
Yeah, we need area-wide approval because the 4 presidents of each county and Lori met with staff to go over this in a committee. We reviewed this for a couple hours in depth and then made additions and edits, and then that's the presentation that area-wide has seen now. And so then we'll need the area-wide to move this forward so that we can then process it with the audit program.
All right.
We do want to do a motion, go draft.
Yes.
Yeah, we got to do a motion. So I'm gonna step away and let Lori come up to the mic.
Got it. So we need to make a motion to kind of move forward with the official word. 2023-2026 strategic area plan.
I move that we accept the strategic area plan for 2023-2024.
We have a second?
Okay.
Any nays? Any discussion? Great, so moved.